Welcome back, everyone. Today we're diving deep into, well, one of life's most incredible journeys, truly transformative stuff. We're talking about bringing a new life into the world.
It really is astonishing, isn't it? Just this
Yeah.
whole process of week-by-week change, both for the baby and for the parent-to-be. So much intricate coordination.
Absolutely. And today we're zeroing in on a really specific, super interesting point in that journey. Week 21 of pregnancy. We've gone through a really detailed guide from Baby Center, pulled out the key info, those aha moments.
Right, and our whole goal here is to give you the essentials, basically a shortcut to feeling really informed about this stage. We've looked at everything, the baby's development, what you might be feeling, and some really practical things to think about right now.
Yeah, we want you to feel prepared, maybe a bit more empowered, definitely connected.
Exactly. So we'll cover what your baby's up to, their senses, which is pretty amazing, changes in your own body, and some tips for this stage, which some people actually call the golden time of pregnancy.
The golden time. I like the sound of that. Okay, let's jump in. Where do we start?
The baby, I assume.
Let's do it. The star of the show, your baby, at 21 weeks. This is a really pivotal time for development. Lots of things coming online.
Okay, so paint us a picture. Week 21, how big are we talking? What's the scale?
So at 21 weeks, they're having a pretty decent growth spurt. Head to toe now, we're measuring them head to toe.
Ah, okay, not crown to rump anymore.
Exactly. And that gives you a much clearer idea of their actual length. So about 10.79 inches, give or take.
Wow, okay, nearly 11 inches.
Yeah, roughly.
Yeah.
And weight-wise, around 14 ounces, maybe think. Like a large mango. Or a good-sized banana, maybe.
A mango, okay, I can picture that. That's substantial.
It is. And it's not just size. It's about all the systems maturing, getting ready. They're becoming much more defined.
Define. And you mentioned senses coming online. That sounds fascinating. What's happening there?
This is, I think, one of the coolest parts. Their sensory development is really kicking into gear. And one of the big ones, taste buds. They actually have working taste buds now. Working taste buds. Seriously.
Yep. And get this. They are tasting the flavors from the food you eat through the amniotic fluid they swallow.
Wait, hold on. Tasting my dinner. How does that even work? What does that mean for them?
It's pretty amazing, right? Basically, when you eat, flavor molecules from your food get into your bloodstream,
Right.
cross the placenta, and end up in the amniotic fluid.
So the amniotic fluid changes flavor depending on what I ate.
Subtly, yes. It carries those flavor notes.
Yeah.
And your baby is constantly swallowing this fluid, quite a bit of it. Actually, maybe up to a liter a day around now.
A liter. Wow.
Yeah. So as they swallow, those little taste buds are getting stimulated by the flavors.
So they're getting a prenatal flavor education.
That's a great way to put it. And studies suggest it might actually influence their preferences later. Like babies whose mothers drank carrot juice during pregnancy seemed more open to carrot flavor later.
No way. So my diet now could make them less picky later. That's motivating.
It could, potentially. It's like you're introducing them to a variety of tastes very, very early.
Mhm.
It shapes their palate in these subtle ways. It's really a profound connection, isn't it?
It really is. Okay, mind blown on the taste buds. What else are they practicing in there? The source mentioned the sucking reflex.
Absolutely. That reflex is developing really strongly. It's actually quite common for babies at 21 weeks to be sucking their thumb or maybe their fingers.
Ah, like you see in ultrasound sometimes.
Exactly. You might even catch them doing it. And it's not just cute. It's crucial preparation. It's practice for feeding, breastfeeding, bottle feeding, whatever comes next. Developing those muscles, that coordination.
Right. Makes sense.
But it's also more than that. It's an early form of self-soothing. They're already figuring out how to comfort themselves. It shows real neurological development.
Incredible. Learning life skills already. Okay, let's talk about what they look like. We picture newborns as plump, but is that the case at 21 weeks? What about their skin?
Ah, good question. That smooth, plump look, that comes later. Right now, at 21 weeks, their skin is actually quite wrinkled. And it's very thin, translucent even.
Wrinkled and translucent, so kind of reddish.
Exactly. You can see the tiny blood vessels underneath, which gives it that reddish appearance. Totally normal for this stage.
Okay, so why the wrinkles? Why isn't it smooth yet?
It really comes down to fat. They haven't developed much subcutaneous fat yet. That's the layer just under the skin that gives babies that lovely chubby look.
Okay.
That fat layer will build up a lot in the coming weeks and months. It provides insulation, energy stores, and it's what eventually smooths out those wrinkles and makes the skin opaque.
Right.
They're basically building their padding.
Got it. It's a work in progress. What about finer details, like facial features?
Oh yes, the details are coming in beautifully. You can actually see their eyebrows now, little tiny eyebrows making their appearance.
Eyebrows. Wow. Wow.
And sweat glands are starting to develop in the skin, too.
Okay.
That's another step towards being able to regulate their own body temperature after birth. And here's something really amazing. Their fingerprints are now fully formed and permanent.
Permanent fingerprints. At 21 weeks, that's mind-boggling. Their unique identity literally etched on them already.
Isn't it incredible? Those unique ridges and patterns on their fingertips are set for life. It's influenced by genetics, but also the specific pressures and environment inside the womb, just completely unique to them.
Wow. Okay. And you mentioned swallowing amniotic fluid earlier for tasting. Does that serve other purposes too?
Yes, absolutely. It's not just for taste practice. Swallowing that fluid is vital for their digestive system development. It helps the gut mature, practice absorbing nutrients, getting ready for milk later on.
Right.
And it also helps regulate the volume of amniotic fluid in the sac. It's all interconnected.
Which brings us back to the expecting parent. How does all this connect to your health, especially that amniotic fluid part?
Well, maintaining a healthy volume and quality of amniotic fluid is really important for the baby's environment, cushioning, temperature, movement. And your hydration level directly impacts that. Staying well hydrated helps ensure there's enough fluid.
So drinking enough water isn't just for me, it's directly supporting the baby's little world in there.
Precisely. It's all one system right now, which is a good transition, actually, to talk about your body at 21 weeks. Because there are definitely some noticeable changes happening for you, too.
Okay, let's dive into that because, yeah, pregnancy symptoms are real and sometimes surprising. What are some common ones around week 21?
Definitely. Understanding what's going on can make it easier to manage. Let's start with one that quite a few people experience,
Yeah.
varicose veins.
Ah, yes, those swollen, sometimes uncomfortable veins, usually in the legs, right?
Yeah.
The source says they're more common now. Why is that? And what can you actually do about them?
It's often a combination of things, really. First, simple physics. Your growing uterus is putting more pressure on the big veins in your pelvis, especially the one returning blood from your lower body. This makes it harder for blood to flow back up from your legs.
So blood kind of pools down there.
Exactly. And then you add hormones into the mix. Progesterone, which is high during pregnancy, actually relaxes the walls of your veins.
Oh, interesting.
Yeah, so the vein walls are stretchier and more likely to bulge or swell when that blood pools. So it's pressure plus relaxed vein walls, kind of a double whammy, like you said.
Okay, that makes sense. So what helps? What are the practical tips?
There are definitely things you can do. Improving circulation is key. So gentle, regular exercise is great. Walking, swimming, prenatal yoga things that get the blood moving without high impact.
Right.
Also, try to stay within the recommended weight gain range for your pregnancy, as extra weight adds more pressure. And positioning is huge.
Yeah.
Elevate your feet whenever you can, like prop them up above heart level a few times a day, even for 15, 20 minutes. Gravity helps drain the blood back up.
Okay, feet up. Got it.
And try not to cross your legs or ankles when you sit. Avoid standing or sitting in one position for too long. Get up and move around frequently, even just for a minute or two.
Little movement breaks.
Exactly. And compression socks, they can make a really big difference. They provide graduated pressure to help push that blood back up towards your heart. Lots of people swear by them.
Good practical advice. Okay, what's another common symptom? The source mentioned bleeding gums, pregnancy gingivitis.
Yes, that's surprisingly common. Affects about half of pregnant individuals. It's basically inflamed gums that might look redder, swollen, and tend to bleed easily when you brush or floss.
Why does pregnancy cause that? More hormones.
You guessed it. Again, those pregnancy hormones, especially progesterone, increase blood flow to your gums and make them more sensitive and reactive to the normal plaque bacteria in your mouth.
So they just get irritated more easily. Is it serious?
Usually, no. For most people, it's just uncomfortable and needs good management. The main concern is if it progresses to severe gum disease, periodontitis, which involves infection deeper around the teeth and bone.
And that has been linked to pregnancy complications.
That's right. Severe periodontitis has been associated with potential risks, like preterm birth or low birth weight. The theory involves the chronic inflammation potentially triggering wider issues, so you don't want to ignore bleeding gums.
Okay, so what's the fix? Just better brushing.
Good oral hygiene is definitely the cornerstone. Brush gently twice a day with a soft brush. Floss daily. Really important to get plaque from between the teeth. And maybe use an antiseptic mouthwash if your dentist recommends it.
And seeing the dentist is okay during pregnancy.
Absolutely okay, and actually highly recommended. Regular checkups and cleanings are safe and important. Your dentist knows how to handle dental care during pregnancy. They can help you manage the gingivitis and make sure things don't progress. Don't skip your appointments.
Good to know. Okay, next up. Clumsiness. Feeling a bit off balance. Is that a real thing?
Oh, it's definitely a real thing. Your center of gravity is shifting forward as your belly grows. That automatically makes you feel a bit less stable.
I can imagine.
Plus, there's another hormone, relaxin, which loosens up the ligaments in your pelvis to prepare for birth. But it can affect other joints too, making you feel a bit looser, maybe less coordinated. So yeah, feeling unsteady or clumsy sometimes is pretty normal.
But it sounds like it could be a safety issue, too.
It absolutely can be. A fall, especially one where you hit your abdomen, could potentially be harmful. There's a risk, though generally small, of things like placental abruption. So safety really needs to be top of mind.
So, practical tips. No ladders, I'm guessing.
Definitely avoid situations with a high fall risk. No climbing on chairs or ladders. Avoid carrying really heavy or awkward things. Wear supportive, low-heeled shoes get the stilettos for now.
Okay, sensible shoes.
Yeah. And just generally slow down. Be extra careful on stairs, use handrails, watch out for wet or uneven surfaces. Just be more mindful of your balance as it changes.
Makes sense. Now, something that can cause a bit of anxiety if you don't know what it is, Braxton Hicks contractions, the practice ones.
That's right. Braxton Hicks are basically your uterus doing little practice squeezes. They're usually irregular, don't follow a pattern, and typically aren't painful. More like a tightening or hardening of the abdomen.
And they can start around 21 weeks.
Yeah, many people start noticing them in the second trimester, around now or later. Some people feel them strongly, others barely notice them, or not at all. All of that is normal.
What triggers them?
Common triggers include being dehydrated. The uterus is a muscle. It can get irritable, having a full bladder, being very active, or even sometimes just someone touching your belly, or after sex. Often people notice them more at the end of the day.
Okay, but the big question, how do you tell the difference between these practice ones and actual preterm labor? That sounds crucial.
It is absolutely crucial, and sometimes it can be tricky. The key differences usually are Braxton Hicks are irregular, they don't get closer together, they don't increase in intensity, and they often ease up if you change position, rest, or drink water. Real labor contractions tend to become regular, get stronger, last longer, and get closer together over time, and they don't stop with position changes.
But if you're unsure,
If you have any doubt, or if your contractions start feeling regular, like say more than 4 or 5 in an hour, or become painful, or if you have any other signs like vaginal bleeding, fluid leaking, constant low backache, or pelvic pressure, you call your doctor or midwife immediately. Always, always err on the side of caution. Don't wait.
okay, that's really important advice. Call if unsure. Got it. What about heartburn? That lovely burning feeling.
Heartburn. Another very common companion in pregnancy. It's that burning sensation rising from your stomach up towards your throat.
And again, hormones and physical changes.
Exactly. Progesterone strikes again. It relaxes the valve between your esophagus and stomach, making it easier for stomach acid to splash back up. Plus, your growing uterus is pushing upwards on your stomach, physically squishing it and encouraging reflux.
So it's almost inevitable for some people.
Very common, yes. While usually harmless, it can be really uncomfortable, interfere with sleep, make eating unpleasant. It's definitely something people look for relief from.
So what works? What are the strategies for relief?
Several things can help. Diet-wise, try identifying and avoiding your triggers. Common ones are spicy food, fatty or fried food, chocolate, citrus, tomatoes, caffeine, carbonated drinks. Eating smaller, more frequent meals instead of big ones can help too. Don't eat too close to bedtime. Give yourself a couple of hours to digest before lying down.
Okay, dietary tweaks. Anything else?
Yeah, prop yourself up with extra pillows when you sleep, or use a wedge pillow, so gravity helps keep the acid down. Wear loose clothing around your waist. Sometimes chewing sugar-free gum after meals can increase saliva and help neutralize acid. And if it's really bothersome, talk to your doctor about safe, over-the-counter antacids. Some are fine in pregnancy, but you need to check first.
Lots of options to try there. Finally, in terms of body changes, let's touch on weight gain. What's typical around 21 weeks?
Around this stage, gaining about a pound a week is pretty average for many people, assuming they started pregnancy at a healthy weight.
But it's not the same for everyone, right?
Absolutely not. Healthy pregnancy weight gain is very individual. It depends heavily on your pre-pregnancy weight, or BMI. That pound a week is a general guideline, but it varies.
So how do you know what's right for you?
The best way is to talk directly with your doctor or midwife. They'll consider your starting weight, whether you're underweight, healthy weight, overweight, or obese before pregnancy, and give you personalized guidance. There are general guidelines based on BMI categories, and online calculators can give you an idea, but your provider's advice is tailored to your specific situation.
Right. A personalized approach is key.
And remember, weight isn't just fat. It's the baby, the placenta, amniotic fluid, increased blood volume, your uterus growing, breast tissue, and yes, some necessary maternal fat stores for energy and breastfeeding. It all adds up.
It does. And keeping track of all these symptoms, weight gain, baby kicks, it can feel like a lot. Are there tools to help manage it all?
There are. Using a pregnancy app can be really helpful for many people. You can track your symptoms, appointments, weight, maybe even things like fetal movement once you start feeling it regularly.
And that helps how?
It helps you see patterns, gives you organized information to share with your doctor, and can just help you feel more connected and in tune with what's happening. It can reduce anxiety by making things feel a bit more manageable and documented.
Okay, that makes sense. So we've covered the baby's amazing progress and the changes in your body. Let's shift gears to the practical stuff, the to-do list for week 21. What should be on the checklist?
Right, preparation is key, both for comfort now and planning for the baby's arrival. It helps ease anxiety and gets things in place.
First up, a simple one the source mentions. Check your rings.
Yes, such a practical tip. Swelling in fingers and hands is really common due to extra fluids and blood volume. If your rings feel even a little snug now, take them off.
Before they get properly stuck.
Exactly. They can become really difficult, sometimes impossible to remove later without being cut off. So take them off now if they're tight. You can wear them on a necklace chain close to your heart if you like.
Good idea. But swelling can also be a warning sign, right? When should you worry?
That's a critical distinction. Some mild swelling, especially in feet and ankles towards the end of the day, is normal. But if you notice sudden or severe swelling, especially in your hands, face, or around your eyes, or if swelling is accompanied by a bad headache, vision changes, or upper abdominal pain, you need to call your doctor or midwife right away.
Why? What could that indicate?
It could be a sign of preeclampsia, which is a serious condition involving high blood pressure that needs immediate medical attention. So any sudden or excessive swelling, definitely get it checked out promptly. Don't hesitate.
Okay, very important safety check. Speaking of safety, let's revisit activities. We talked about clumsiness. What specific activities should be off limits now because of the risks?
Right, with that changing center of gravity and growing belly, avoiding falls and abdominal trauma is paramount. The source gives a pretty clear list.
Let's hear it.
Okay, so definitely avoid. Scuba diving risk of decompression issues for the baby. Acute contact sports like basketball, soccer risk of impact. Snowboarding and downhill skiing, high fall risk. Hot yoga or anything that drastically raises your core temperature risk of overheating.
Okay, no extreme heat.
Right. Also, horseback riding again, fall risk. Hot tubs and saunas, risk of overheating, especially early on, but generally advised against. And things like four-wheelers, water slides, intense amusement park rides, risk of jolts, impacts, or falls.
Basically, anything with a high risk of falling, impact, or overheating.
That's the essence of it. It's about protecting both you and the baby from potential harm. Risk assessment is key.
Makes total sense. Now, shifting from physical safety to financial security, planning for a baby involves money. What should expecting parents be thinking about financially around now?
It's a really good time to start tackling this, as it can reduce stress later. Adding a baby definitely impacts the budget. So reviewing your finances now is smart.
What specifically should you review?
Several big things. First, your health insurance. Understand your maternity coverage, birth costs, and how and when to add the baby to your policy. That's huge.
Absolutely.
Second, think about taxes. You'll likely qualify for child tax credit, so maybe adjust your withholdings. Look into dependent care accounts if you anticipate childcare costs. Third, wills and estate planning. It's not fun to think about, but crucial. Designate a guardian for your child in a will. Maybe consider life insurance or updating beneficiary.
Ensuring the baby's future is secure. Okay.
Exactly. And fourth, start researching childcare costs and options now. Daycare, nannies, whatever you're considering costs vary wildly and spots can fill up fast. Getting a handle on this early helps you budget realistically. Tackling these things proactively really helps.
That's sound advice. Less stressful than leaving it to the last minute. On a more cheerful planning note, the baby registry is now a good time to start that.
Perfect time. If you're planning a baby shower, or even if not, a registry helps guide friends and family who want to give gifts. And honestly, you do need quite a bit of stuff for a baby.
It can feel overwhelming, the sheer amount of baby gear out there.
It really can. A registry helps you focus on what you truly need and prefer. Start with safety essentials car seat, safe sleep space. Then think about feeding supplies, diapers, basic clothing. Look at reviews. Maybe prioritize multi-use items.
And the source mentioned registry builders.
Yeah, lots of stores or online platforms have tools that help you build your list. They might have checklists, let you compare products, maybe allow you to register for items from multiple places all in one list. They can definitely streamline the process. And don't forget, many offer a completion discount for items left on your registry after the baby arrives.
Good perk. Okay, we've hit physical stuff, safety, finances, gear. What about emotional well-being? Managing stress during pregnancy.
So important. Some stress is normal, life happens. But chronic, high levels of stress during pregnancy aren't ideal. Research has linked it to potential issues like preterm birth, preeclampsia, or low birth weight.
How does stress impact pregnancy physically?
Chronic stress keeps your cortisol levels high, which can affect things like blood flow to the placenta and potentially influence fetal development. So managing stress is really part of taking care of the pregnancy itself.
What are some effective ways to manage stress then?
Several things can help. Gentle exercise, if your doctor approves, is a great mood booster. Talking things out with your partner, friends, family. Don't bottle things up. Build your support network.
Yeah, talking helps.
Mindfulness techniques can be incredibly effective too. Deep breathing exercises, guided meditations. There are lots of apps for pregnancy meditation, or even just taking a few moments to focus on your breathing when you feel overwhelmed. Keeping a journal can also be helpful.
But what if it feels like more than just everyday stress?
That's a really important point. If stress feels overwhelming, if you're constantly anxious, sad, losing interest in things, or having trouble functioning, it's crucial to talk to your doctor or midwife. Don't hesitate. They can screen for prenatal depression or anxiety and connect you with resources like therapy, counseling, or support groups. Getting professional help is a sign of strength, not weakness, and it's vital for both your health and the baby's. Mental health is just as important as physical health here.
Absolutely. Prioritize your well-being. Okay, this has been so thorough. Let's talk about something maybe a bit more fun, the baby bump. The source called this period the golden time. Why?
It often feels like a sweet spot. You're usually past the worst of the first trimester, nausea and fatigue, maybe you have more energy. Your belly is likely noticeably pregnant, which can feel really exciting and affirming.
Like, yes, I'm definitely pregnant.
Exactly, that cute, rounded bump stage. But often, it's not yet so big that it's causing major discomfort, back pain, or making it really hard to move around or sleep comfortably. That tends to come later. So it's this nice phase where you feel pregnant, look pregnant, but might still feel relatively comfortable and energetic.
The golden time, I see it now. And embracing that bump maternity clothes have come a long way, right?
Oh, thankfully, yes.
Hmm.
The days of hiding under giant, shapeless tents are long gone. Maternity fashion now is often stylish, comfortable, and designed to flatter your changing shape.
So you can actually find nice things to wear.
Absolutely. Lots of stretchy fabrics, clever designs with ruching or adjustable waistbands, pieces that grow with you. You can find form-fitting styles if you want to show off your bump, or more flowing things if that's your preference. Many brands focus on clothes you can wear during pregnancy and postpartum. There are so many options now, from dedicated maternity stores to sections in regular stores, online retailers, even rental services. You can definitely find clothes that make you feel good.
It's nice to feel like yourself, even as your body changes. The source also mentioned some fun things, like quizzes about your pregnancy persona, nesting vibe, energy levels.
Yeah, those are more lighthearted ways to think about common pregnancy experiences. The nesting vibe taps into that real urge many people get later in pregnancy to prepare the home, cleaning, organizing, setting up the nursery. It's partly instinctual, partly a way to feel prepared and connected.
Like getting the nest ready.
Exactly. And talking about energy levels powering through versus powering down just acknowledges that everyone experiences pregnancy differently. Some people get that second trimester energy burst, others feel tired throughout. It's validating those varied experiences.
Right. No single right way to feel.
Precisely. And the pregnancy style or vibe is similar, just recognizing the unique journey everyone is on. Then there's the baby zodiac sign, just a fun little point of interest for some people looking ahead.
Okay, before we wrap up, let's just zoom out quickly. Week 21 is amazing, but it's one point on a much longer timeline, isn't it?
It really is. We've focused intensely on this week, but it's part of the whole incredible arc from conception through pregnancy, birth, and into raising a child. Thinking about the resources available for getting pregnant, baby development, toddler stages, it reminds us this is the continuum. Week 21 is a crucial moment for development and preparation, but it beautifully flows into everything that comes next.
Wow. Okay, that was a truly deep dive into week 21. We covered so much ground. Just to recap the highlights. For the baby, incredible things like working taste buds, those unique permanent fingerprints, practicing that vital sucking reflex.
And for you, the expecting parent, understanding and managing common physical changes like varicose veins or heartburn using those practical tips we discussed. Plus the checklist items, checking rings, avoiding risky activities, getting finances sorted, maybe starting that registry.
And crucially, prioritizing emotional well being and knowing when to seek support for stress or anxiety.
Exactly.
Yeah.
Having this knowledge really is empowering. It helps you connect with what your baby is experiencing, feel more prepared for what your body is doing, and navigate this whole journey with a bit more confidence and clarity.
It really does. And it's amazing to think. As your baby's unique fingerprints are forming, as their taste buds are literally waking up to the world through you, this whole process isn't just creating a new life, it's also fundamentally changing your world, preparing you for this incredible relationship and journey of discovery that's really, truly just beginning.
Beautifully put. It's a profound transformation on every level.
Thank you so much for joining us for this deep dive today.